Hello and welcome. My name is Frederick Mwenje. I would want us to have some lesson on basic epidemiology. Basic epidemiology. So we'll take a very short time that we may just gain some basic knowledge on epidemiology. In this presentation, there are only two things that we shall cover, that is introduction to epidemiology and disease causation. So what is epidemiology? A simple definition that we can use, it is the study of frequency, distribution, and determinants of diseases and other health related conditions in human populations, and the application of such a study to the promotion of health, to the prevention of the health problems, as well as controlling the health problems. So looking at that definition, there are key components that I would want us to break down to help us understand more on what epidemiology is. What does it entail? Talking about a population, we realize that this is the focus of epidemiology. A population simply is a group of species that share common characteristics and live within a given geographical location. So that means epidemiology is concerned about that group of species in that specific geographical location. Then the frequency. This shows us that epidemiology is a quantitative field dealing with numbers. And so it's concerned with the frequency of occurrences of diseases as well as other health related conditions. The distribution refers to the pattern of these health events within that particular population. And determinants, we are saying that epidemiology is used to search for causes. So in other words, when talking about a determinant, we are looking at the causes or the factors that influence the occurrence of these health-related events such as diseases, syndromes, and injuries. And then lastly, the component we're looking at is the health-related conditions. And we are saying that these are conditions which directly or indirectly affect or influence health. They may be injuries, they may be births, they may be health-related behaviors like smoking, unemployment, poverty, among others. So how do we use epidemiology? How do we use epidemiology? Or what are the uses? Number one, epidemiology is used to study the history of populations, of health of populations, health of populations. What is the history of health of a specific population? Are there rises and falls of diseases or changes in the character of the population in question? Then the second one, we are saying that epidemiology is used to diagnose the health of a community and the condition of the people in that community. This is simply community diagnosis, and community diagnosis is a comprehensive health assessment of people within that area with a view to finding what their social or physical or biological environments are. Then the third one, epidemiology is used to study the working of health services. And not only stopping at that, but we are looking at the health services, studying it with a view to improving the service delivery in those health services. And then the fourth one, we are saying that it is used to estimate from the group experience what are the individual risks of average disease. What are the individual risks of average disease? How risky is it, maybe for an accident or any defect? And also it will help us to devise ways of avoiding such chances of a disease occurring, or chances of an accident or any defect occurring. Epidemiology is also used to identify syndromes by describing the distribution and association of clinical phenomena in the population. We describe the distribution of the association of clinical phenomena using epidemiology. After getting the distribution, we are able to associate it with clinical phenomena in that particular population. And then lastly, epidemiology is used to practice surveillance for specific disease in order to be able to act quickly. And surveillance will help us to cut short any outbreak like cholera. So when studying the distribution of cases of cholera, we are able to identify, for example, the hotspot areas, the people largely affected, and this will help us to cut short that outbreak, minimize the numbers or cut it short so that the spread is minimized. I would also want us to look at principles of epidemiology. And a simple way of looking at the principles is by looking at the 5 WH words: what, who, where, when, and why. So the first one, talking about what. What in this case, we are trying to ask what is going on. And by that, the simple thing we are talking about is the case definition, which is a standard criteria for deciding whether a person has a particular disease or health-related event or not. In other words, what are these factors? What is it that if an individual has, then they can be categorized as having a disease? The first principle. Then the second one, we are looking at who, and it refers to counting of the persons involved in that particular health event. So epidemiology investigations look at the numbers of the people within a population involved in that health-related event. The third one is talking about where, simply the place or the geographical location. Where are they? Where are these cases? Then the fourth one is talking about the time. When did that case occur? When did it occur? And the last one is why, which